When the hits the fan, this video could save your life. What happens if you find yourself in a desperate need of medical help and you can't get to a hospital or call 911? What the heck do? You should be armed with life-saving information. Having the right know-how could very well mean the difference between life and death for you or a loved one. So pay close attention. These are some of the do's and don'ts of 3 life-threatening scenarios, from gunshot wounds to frostbite and even heart attacks. But of course, if you're experiencing a medical emergency, please call 911 or your country's equivalent. Get to a hospital as soon as you possibly can. If you don't have the luxury, hopefully this video will buy you a few extra minutes or help out in some small way. Alright, let's dive right in. Number 1, heart attack. What do you do if you suspect you or someone you love is experiencing a heart attack? Can you stop it? Short answer, no, but maybe you can reduce the severity until help can arrive. Heart attacks are serious life and death situations and occur when the flow of blood to the heart is blocked. There are many things that can cause the blockage, but in the event of a true emergency, the only thing that truly matters is being able to properly identify the symptoms and attempt to handle it. First and foremost, know that the symptoms, they range for sure, but here are the common symptoms. Pressure or tightness, squeezing pain in your chest that can spread to the neck, jaw, or back. One could also feel abdominal pain or like they want to throw up, or even like they are experiencing indigestion or heartburn. Other noticeable signs are shortness of breath, cold sweats, fatigue, or sudden dizziness. From there, you've determined someone is having a heart attack or likely having a heart attack. What the heck do you do if you cannot get to the hospital? First, determine if the person is conscious or unconscious. If they are conscious or awake, immediately give them aspirin, so long as they don't have some other sort of allergy or other prescription that can interact with it. Taking aspirin during a heart attack could reduce heart damage by helping to keep your blood from clotting. Also, the best position is on the floor with the person's knees bent and their head and shoulders supported. On the other hand, in the worst case scenario, the person is unconscious. You gotta first check to see if they are breathing and have a pulse. To check if they are breathing, tilt their chin up and back to open the airway, and then put your face close to their face so you can feel the breath on your cheek, and then look to see if their chest is rising and falling with breaths. Now, to check their pulse, place these 2 fingers, your index and your middle finger, at the base of their thumb just underneath the bone. If the person isn't breathing or you do not find a pulse, you should begin CPR. Normally, I would never ever suggest it to an untrained person, but in the event of life or death, you gotta at least try and help. CPR, in the most simplest terms, is push hard and fast on a person's chest at about 100 to 120 compressions a minute. This is about the same pace as the song Staying Alive. Staying alive! With CPR, don't do like this, okay? It's not enough force. Do it from your shoulders. You're going the whole body, okay? Don't worry, I'll link to other videos showing CPR if you need it. Now, other things that you can do if you're home alone and this is happening to you, call 911, lay down by the front door of your house and unlock the front door, or put yourself in a very visible location so that paramedics can have easy access to you. Number 2 life-saving scenario if you cannot call 911, gunshot wounds. I'll repeat it again. Getting to the hospital or calling for emergency help is always your first line of defense, as it gives the victim the best odds of survival. But if it is truly the worst case scenario and you cannot immediately get to the hospital, you need to be aware of these tips. First things first, get out of the line of fire. Second thing for any generic GSW is the stopping of the bleeding. This is crucial. If there is a visible hole, wash your hands or use gloves if that's an option, and put a lot of pressure on the wound. Seriously, don't be shy. Stick your fingers right in the wound or use something else to apply direct hard pressure to this area. If the patient is screaming, it is okay. A lot of people's first thought is to go quickly to a tourniquet, but that is not necessarily the best step, as it doesn't always apply the right amount of pressure to the right area, and using them properly takes practice. Direct pressure with your hand or fingers is better. The only time you would use a real tourniquet or some other sort of makeshift one, like a belt apparatus or a bandana type tourniquet, would be if you cannot use your fingers or hand for direct pressure. Say you got shot right here and your brachial artery is bleeding everywhere. Take 1 or 2 fingers. Direct pressure, boom, the blood has stopped. Hard pressure. If I were to circumference with a tourniquet, I'm going to kill everything down below when all I have to do is stick a finger. I need that blood flow to get to the other parts of my arm so I don't cause ischemia and then the whole arm dies. Another don't when it comes to GSWs is don't elevate the legs. This will change the blood flow and maybe even impact the way that the patient is breathing. Just don't do it. You increase the blood to the core, you're gonna bleed out more. Next important step, we also have to adjust specifically where the GSW is located on the body. I'll go over a few quick areas that I typically see in the ER. Chest. Chest wounds can injure the heart, the lungs, the aorta, etc., and can be very deadly. Some of these wounds can also create a seal-sucking situation where it allows air to enter but not out of the chest. We don't want that. For this type of wound, you want to seal the wound. You want an occlusive dressing. So when you take a deep breath in, it doesn't suck any air in. But when you take a breath out, you actually want some air to sneak out. So a good makeshift occlusive dressing, if you don't have like gauze impermeated with petroleum, is like a piece of plastic, okay? Or saran wrap or something to that nature. It doesn't allow any air in or out, but this way you have a small flap on the corner. But a word of caution, if the victim is having trouble breathing or the breathing gets worse after you put the seal on in this area, just remove it. Another area to be aware of for GSWs is the neck or the back. This is a super tricky area where any movement could damage the spinal cord or cause permanent issues like paralysis. Besides paralysis and spinal cord injuries, you have your major blood vessels of your neck, your carotid and your jugulars. Those can be ripped to shred and you can bleed out pretty fast. That area, make sure if you're bleeding, direct pressure, don't put a ton of gauze, and don't do a circumferential wrap because you'll actually choke the person to death. Another common misconception, removing bullets. This is a big one. Depending on where it is in your body, 9 out of 10 times you do not, I repeat, do not remove the bullet. You may do more damage trying to get it out. Also, keep in mind that someone with a gunshot wound might have substantial internal injuries.
I'm picking up a distress signal in the liver, Morty.
That could lead to difficulties with breathing, low blood pressure, and even heart issues. Begin CPR immediately if they are not breathing and maintain strong pressure to the wound to try and stop the bleeding at the same time. The next bad, life-threatening scenario you may have to unfortunately deal with, frostbite. Frostbite is an injury caused by freezing of the skin and underlying tissue. It usually happens in areas that are smaller first, like your fingers or your toes, and it's like a burn. You may be surprised to learn frostbite can happen in as little as 5 minutes if the skin is left exposed to cold temperatures. So take this seriously. Alright, what does it look like? At first, the skin that's not covered might get a little red or sore, and that's called frost nip, usually the first sign of worse things to come. If it progresses, frostbite will go beyond and advance to muscles and bones below. Skin might turn yellow or white at first and feel like pins and needles or burn or itch. You may even see blisters form. Ignore all those signs of frostbite and things could get really dire quickly. In advanced stages of frostbite, the skin is very hard to the touch and may even start to turn a darker shade of blue or black. Most patients with frostbite at this point can't even feel their affected body part. So that is why it is super important to pay attention and look at the skin, as this may be the only indicator of how bad the process is. How do you treat it? Of course, the hospital is always the first line of defense, but when there are no other possible options, first, you've got to get somewhere warm and find some way to warm yourself up. Do not, however, rub the skin. This will only make things worse, and your skin could fall off.
1, 2, 3.
So what you should do though, if possible, soak the affected area, such as your hands or your feet, in warm flowing water. I repeat, warm flowing water, not hot scorching water, because you have to slowly warm yourself back up. Because you can't feel your skin, you could actually burn it without even knowing it. Warm water or things like warm washcloths or sponges with water on the affected areas that cannot be submerged, like your nose or your ears, for instance. Do this for at least 30 minutes. As you thaw out, it's not going to feel great. A person may experience painful stinging or prickling sensations, or even get blisters as things start to thaw out. You may want to introduce some pain medications if you need it for nerve pain as this happens. Some studies out there suggest that aspirin may even help restore blood flow to the body parts with severe frostbite within 23 hours of rewarming. In extreme frostbite scenarios where the blood flow won't come back and the skin is necrotic or dead, one may need surgery to remove that area. That way it doesn't get infected and cause more damage to the tissue around it. Obviously, there are many life-saving scenarios that we could go over. If you want to hear about other life-saving medical hacks, click on this playlist right over here. Or on the other hand, if you want to laugh, click on this playlist. And make sure you subscribe if you haven't already done so. Thank you so much for watching, and stay healthy, my friends.